Abby Johnson here, former Planned Parenthood director, now pro-life and pro-women advocate. I want to talk about this question that keeps coming up, particularly as states are going in and defunding Planned Parenthood. People keep saying, well, where are women going to go if they're poor and they need health care and they don't have access to Planned Parenthood? Well, the answer is pretty simple, and we've seen graphics going around that show this. We've heard people talk about it. I've typed about it a lot of times on Facebook, but somehow people are just still not getting it. So I thought maybe I would explain it to you in a video. When a woman goes into Planned Parenthood, let's say a woman goes in and she's going to have her annual exam at Planned Parenthood. And let's say during the exam, they find that she has elevated blood pressure. What can Planned Parenthood do? Nothing. They can't do anything about it. They can't prescribe her medication for high cholesterol, high blood pressure, abnormal thyroid, if they have a sinus infection. They can't prescribe medication for any of that because Planned Parenthood does not provide comprehensive or primary care. Planned Parenthood only provides extremely limited gynecological care. So what can they do? They come in, they find out they have high blood pressure, and they have to send them to another center. Where do they send them? They send them to a federally qualified health center, more than likely. We know that there's over 10,000 federally qualified health centers in the United States. FQHCs provide comprehensive and primary health care for men, women, and their children. It is literally a one-stop health center for people who maybe are low income, who are underinsured, that need health care. That's where Planned Parenthood would send them. So if you're a woman who is strapped for money, why would we want to send her all over town to receive the health care that she can get at a federally qualified health center or a county health department or a rural public health center or a hospital health system? Why would we send her to Planned Parenthood where they actually can't take care of the majority of her health needs when we can send her to one place that can? So just as an example, here in the state of Texas, we have only 35 Planned Parenthood facilities in the whole entire big state of Texas. We have almost 5,000 providers of the Texas Women's Health Program. That's a program that can see low-income women at no cost for comprehensive and primary health care if they need it. So why do we want to send them one place that can't provide care for their health needs, when we could send them to one place that can? 35 clinics compared to 5,000 healthcare clinics, and that's just in the state of Texas. Planned Parenthood does not exist anywhere in any city where there are not other options for healthcare for women. So please don't believe the lie. Please share this video. Please show women these infographics that show that in some states there are actually no Planned Parenthood facilities, and there are an abundance of places where women can get health care. We don't need Planned Parenthood. We need better providers. We need better health care, and Planned Parenthood is never going to rise up to that challenge to actually be a comprehensive and primary health care provider, because they actually don't want to do that. They're not interested in helping women. They're not interested in providing comprehensive health care for women. They are interested in selling them on a birth control method that is eventually going to fail them so that they can get them back in there for an abortion, because that's how they make their money. That's why Planned Parenthood is even seeing women for family planning services. Planned Parenthood is actually a loss leader in family planning, but they're okay with that, because even though they may always be in the red for family planning, they will always be in the black for abortion. And that's why they're trying to get women into their doors, to get them hooked on a contraceptive method that will eventually fail them so they can get them in for an abortion. And if the Planned Parenthood's really lucky, they can get them in for multiple abortions. That's how the Planned Parenthood model works. Please don't believe the lie. Please send women to centers other than Planned Parenthood where they can actually receive quality health care.